My name's McDowell and I'm a Diabetes Specialist Dietitian. So my role involves providing specialist dietetic input for patients with diabetes. So that can be patients with a range of different diabetes, so say type 1 diabetes, type 2 diabetes, type 3C diabetes, or other diabetes such as steroid-induced diabetes. And my main role is to provide a dietary input for that patient, so to provide advice and treatment from a dietetic point of view. And this can be in a whole range of different clinical settings, so on a ward with a patient, maybe in a clinic setting, a consultant clinic, or even group education. So we provide structured patient education for patients with diabetes, so as to empower them with the knowledge and education around their diet to help them self-manage their diabetes and to overall kind of improve their diabetes control. So I work closely with a multidisciplinary team, so specialist diabetes nurses, consultants, podiatrists, pharmacists. So we're a real team that pull together for patients with diabetes. The favourite thing about my job is how rewarding my job can be. So just with working with a patient, working together to help them to make dietary changes that they can sustain, that they're able to put in place to help them with their diabetes control. So when you have a patient that just gains such knowledge and gains that motivation to be able to do that, and you see their diabetes improved, is very, very rewarding. I also love working with other members of the multidisciplinary team and just learning from one another and being able to, I suppose, work together and bounce ideas off one another to be able to help a patient move forward in their diabetes control. So I'm only very new to this role, so I've been here 2 months in this job, so I haven't actually started any projects as yet, but one that I'm really excited to get going with and to put in place at Craigavon Area Hospital is to work very closely with catering and to be able to put in place a menu for type 1 diabetic patients to help them carb count whilst they're in hospital. So yeah, so that's something I'm really excited about and going to start getting ready to prepare that within the next coming months. So again, I've only worked within the Health and Social Care Trust here for 2 months, but so far everyone has been so supportive and so friendly, and the guidance has been fantastic in terms of, I suppose, providing me with a very good induction, helping me to get to grips with what I need to be doing, and just supporting me, I suppose, to get to know the trust, but also working within the health and social care. So it's been a fantastic team and trust to work for. Really, really friendly staff. In terms of dietetics, I would say go for it. If you're passionate about caring for people, have a real interest in nutrition, then I would say 100% dietetics would be something to explore. It's just a wonderful opportunity to kind of have a good input from a science point of view, from a nutrition point of view, and just the elements of digestion and how food can really, really help improve somebody's health is fascinating, but also something so enjoyable to be a part of. And like I say, it's so varied. So you could work within a hospital, you could work within a community, and also with other teams as well. So it really is a variable post to work in.